Diagnosis of PCOS. Step 1. Clinical assessment. Medical history. Detailed history of menstrual cycles, symptoms of hyperandrogenism, and family history. Physical examination. Examination for signs of hirsutism, acne, and obesity. Step 2. Laboratory tests. Hormone levels. PCOS can show following abnormalities: elevated androgens, testosterone, DHEAS, high LH to FSH ratio. Ratio can be as high as 2:1 or even 3:1. It is only 1:1 in normal females. Other hormones, prolactin, TSH, and cortisol, to rule out other conditions. Step 3. Imaging studies. Transvaginal ultrasound, to visualize the ovaries, and check for the presence of multiple follicles. Diagnostic criteria of PCOS. Rotterdam criteria requires 2 of the following 3 features: oligo or amenorrhea, irregular or absent menstrual periods, clinical or biochemical signs of hyperandrogenism, polycystic ovaries. On ultrasound,